Welcome to Newsmax TV. I'm Kathleen Walter. With us now on the phone is Representative Renee Ellmers, Republican from North Carolina and a member of the House Energy and Commerce Committee. And Representative Ellmers, thanks for joining us today.
Oh, thank you for having me.
Well, President Obama this afternoon delivering a speech in which he lays out the framework for U.S. counterterrorism strategy. The speech comes on the heels of what appear to have been homegrown jihad attacks in Boston and in London yesterday. And in this speech, he's expected to address the closure at Gitmo and clarify his position on drone strikes. Now, as a former member of the Foreign Relations Committee, what is your assessment of the president's counterterrorism strategy?
Well, it's nice to know that he has a plan of action that he's putting forward now. Unfortunately, it is a little late. I think that, had we seen his leadership on many of these issues earlier on, we would be in a much better place. So I'm almost thinking that some of these things are not just reactionary, especially when we consider Benghazi and when we consider, the bombings in Boston that took place. So although I'm very happy that he's putting forward a plan that he really has not taken the initiative on in the past, I do wish it had happened a little sooner.
Many Republicans adamantly oppose the closure at Gitmo, but it's been reported that the president expects a small number of Republicans will back him. Do you see that happening, or will House Republicans stop him?
Yeah, that's one of those issues that's been out there for so long. There's pros and cons, to this way of thinking, especially now, when we're talking about terrorist attacks and whatnot. So I do believe there's going to be pushback back on the issue. And to be honest, it's one that he hasn't pursued in the past. Even though he promised it in his campaign speeches in his first term. So there's a reason there, and I think it may be rooted in lack of support on even his side of the aisle.
Mm-hmm. Certainly the administration with this speech today is hoping to move beyond the scandals of recent weeks, including Benghazi, the IRS scandal, AP phone records, and the targeting of Fox News. What do you view as the biggest abuse of power by the president himself?
Wow. Well, it really is hard for me to believe that some of these things, he didn't know about the IRS situation a little sooner. Of course, the pieces of the Benghazi situation are still unfolding, and, we don't know who knew what when. But these things had to have gone to the level of the White House, especially when we're talking about the IRS situation. We're talking about the Department of Justice, with the Associated Press. That's another area. Somehow those decisions were being passed down from somewhere, and that's the thing that we need to know. And the American people need to know this. They need to know what's happening. And the abuse of power here, I think probably the biggest abuse of power would be with the IRS. Here's an agency that can ruin lives, families, lost income because they may be targeted, and a situation where groups and individuals are being targeted by the IRS. This is the agency that will be charged with enforcing Obamacare. And obviously the size of government, especially when you're talking about the IRS, has gotten way too big. That's why we really want to work hard on tax reform to simplify the system and to take away some of their control that they have. But also, is this really the agency that should be overseeing Obamacare and whether or not individuals, have health care coverage? That's maybe a little bit too much information that they should not have.
We talked about Benghazi earlier. Do we need a select committee to investigate Benghazi?
Well, I'll tell you, that's one of the things that we're looking very closely at right now. And I see the committees of jurisdiction doing great work. And I believe that this should be and could be done through congressional means. What I'm afraid of if we move forward with an outside commission is I don't want to let anything go before us where we've lost ground. And I don't want it to be a process that becomes an endless process. We know how those things can get out of control. We have the authority, many of our committees have the authority to go in and do that oversight and investigation. And if it's a coordinated effort, I think we can accomplish it in the House. And that's really where I would like to see it stay.
Let's switch gears for a second. Considering that in addition to being a lawmaker, you're also a nurse, I want to get your unique perspective on Obamacare. The House last week voted to repeal Obamacare. What more will House Republicans do to stop the legislation? And can't you just defund it altogether?
Well, that's what we're doing piece by piece. You know, every time one area is being exposed, you know, to the American people, and it just shows how out of control it has gotten. You know, we're talking about health care coverage. We're talking about individuals' lives, health care themselves, the ability to have health insurance, but we're also talking about the economic impact, you know, with our employers, our job creators who are coming to us and they're saying, you know, if this thing goes forward, I don't know what I'm going to do. I'm going to have to lay off staff. I'm going to have to take full-time employees and make them part-time, or I'm going to have to close my doors because I don't see how I can afford it. And these are the things that we're hearing from. We're hearing from the American people on this. One of the things that we're doing right now is putting together through the Whip's office a coordinated team, a working group, where we're talking about this and we're looking at this. You know, as we get closer and closer to implementation, you know, it becomes a more serious and serious problem. We know that it is full of holes and that it truly is falling apart. The problem is that the president and his administration see the hardworking taxpayers of America as that endless source of funds to continue to keep it going. We've got to make sure that we're making good, sound decisions and what should go forward and what should not. I would love to see full replacement with a good patient-centered plan where we are taking care of patients, where we're making sure that health care coverage is affordable for every American, but at the same time, making sure the quality of care is not affected. That's one of those areas right now with Obamacare where whether you are for it or whether you're against it, there's nothing in it that will improve quality of care, and that's a very big concern for me as a nurse.
You've introduced legislation to immediately reverse the sequester cuts that have led some cancer clinics to turn away Medicare patients. I understand cancer clinics are now turning away thousands of patients being treated with drugs that clinics can no longer afford. Just how critical is this situation, and how does your Cancer Patient Protection Act fix the problem?
Well, what it does essentially is, you know, unfortunately this was a negative consequence associated with the 2% across-the-board cuts. This is why across-the-board cuts are never the way to do spending cuts in Washington. They should be done strategically so that you're making good, sound decisions and cutting wasteful spending rather than needed programs. You know, unfortunately, those cancer patients who are on Medicare are being negatively affected because those community cancer centers are being cut twice, essentially. The physicians are being cut in their reimbursement, but then also the cancer drugs themselves, which are incredibly expensive, are being cut 2% as well. So you see the problem. What we are not doing is we're not reversing it so much as we're saying this cut is in place, but, you know, we need to move it somewhere else. And you know, within that same system, and look, the problem that we're seeing, even that, you know, that's the standpoint where I stand back and say we've got to make sure these cancer patients who are on Medicare are being taken care of. They will get their care, but they'll be sent to a hospital, and sometimes those hospitals could be 20 miles outside of their communities. So if they're on a fixed income or a low income, they don't have transportation to that hospital, you know, they're not going to go for their treatment as needed. So that's an issue. But also it costs more at the hospital because they are under a different reimbursement through Medicare. So it ends up costing about $6,500 more per year per Medicare patient, but then another $650 out of pocket for that particular patient as well. So you see how it completely negates the sequester to begin with. So for those who are, the fiscal hawks, they should see this as extra spending or increased spending if we keep going on this path.
On a completely separate issue, Representative Ellmers, Republicans fared poorly with women voters in the recent presidential election. As a member of Maggie's List, an organization which helps to elect conservative women, do you feel that conservative female lawmakers such as yourself can help the GOP win over women voters in 2014 and in 2016?
Absolutely, and I'm so glad you asked me about that. That is one of my main initiatives right now. I have the honor of being elected the chairman of the Republican Women's Policy Committee, and we will be moving forward on all kinds of women's issues. We believe very soundly, very strongly, that the issues we care about are the issues that women care about. Those issues of gas prices and food prices and educating their children and health care. All of these things are important to women. We've got to make sure we're letting women know that we get that, we understand it, we care about where they are and what they're doing, and we are going to be working to make sure that we're building that network of support for women across this country, but also so that they understand who we are in Congress. And we're going to be working very diligently at that effort. We want to get many more Republican women elected into Congress as well, and that's going to be part of our effort. And I'm just so excited to be part of it because we got it in this last election. We understand that we are not reaching out to women well enough, and we are going to change that.
Last question for you, Representative. It's been reported that you're considering a run for Senator Kay Hagan's seat in North Carolina next year. Do you plan to run?
We are just about that time where we have to sit down and make that decision, and I truly, honestly am not there just yet. And now with as much as I'm doing in the House, my heart's kind of there in the House, so it's a difficult decision to make. But I will tell you that it is a winnable seat, and I'm ready to do it if it comes forward that's what I should do. But at the same time, if not, and my place is to stay in the House, then what I want to do is support whatever candidate moves forward. Ultimately, I want to do what's right for North Carolina, especially District 2.
All right, Representative Renee Ellmers, thanks for being with us today.
All right, thank you so much.
And thank you for watching Newsmax TV.